Welcome to all of you for Camp Maddie Kitten Edition. I'm Monica Tarrant, Chief Innovation Officer for Give Them 10. Joining us now is Dr. Julie Levy, the Fran Marino Endowed Distinguished Professor of Shelter Medicine Education at the University of Florida, also one of my best mentors and heroes. She'll talk to us about medical protocols tailored for kitten care in shelters and rescues. Welcome, Dr. Levy.
Thank you, Monica. It's been a great pleasure to be here, and what an inspiring start that you've launched to today. So I'm going to spend the next hour talking about medical protocols that are specifically tailored to the needs of kittens that are in shelters and rescues. And you've already heard that the numbers of kittens that we need to help are unsurmountable in some ways in most parts of the country. And so a lot of what I'll be talking about is how to be more efficient, how to upscale programs so that we can help more kittens. This is what I'm going to cover today. One is about how many kittens are out there and how we can streamline our operations to help the most kittens possible. Some preventive care protocols that are essential for keeping our kittens healthy, to talk about pediatric neutering and how important that is, and dispel some myths around that. And then finally, responding to common disease threats that we encounter with kittens. Now, this is a lot. And so I'm going to move pretty quickly through a lot of content. I'm going to provide all of the slides for you as a downloadable document after the presentation. So you don't need to take a lot of notes, but I'd suggest that like our vet students, you kind of sit back, drink from the fire hose, and then you can regroup at the end when you get the presentation. So strap in, here we go. So first I'd like to talk about who's here today, because this really helped us decide what to talk about. So of all the more than or nearly 2,000 folks who've registered, most of these are from private animal shelters, followed by government shelters and then rescue groups. We asked the audience to tell us about their combined community capacity to meet the needs of kittens. So not just think about their own organization, but all of the kittens that are out there in rescues or maybe just out in the field, or the number of cats that are coming through TNR programs. And so about half of respondents said they were seasonally coping. That meant probably that except for kitten season, they were doing okay keeping up. And then mostly okay, but struggling some of the year. Then finally, there's the groups that are struggling continuously. We see a lot of those here in the South, where we have such mild winters and really overwhelmed by cat overpopulation and breeding of community cats. And then a tiny group, 3% of you need more kittens because you can't get enough kittens. And we always wonder how that can be possible. So this is just a recap. You've already seen some of this data from Shelter Animals Count. They just released their 2024 year-end data. And the good news is that cats do have higher live outcomes than they did before the pandemic in 2019. So there were about 3 million community intakes. This excludes transfers. And 89% of those had a live outcome. Now, remember that Shelter Animals Count is a voluntary service, and so not all shelters put their data in here. That live outcome rate seems a little high to me for national statistics, but that is the data that they've collected. The sad part is that kittens have the highest non-live outcome of any shelter population, and Monica touched on this. They're more than twice as likely as dogs to die in care. And this is a huge welfare issue. This means that the animals were either found dead in their cage or died being surrounded, but not actually benefiting from a humane euthanasia. And we need to do better on that. We need to understand when kittens are not thriving and on a path to dying, or also we need to be able to euthanize them as we would for everybody else when they're suffering and they're not recovering. 73% of the kittens that died in care were less than 8 weeks of age. I don't think anyone's going to be surprised that it's our neonates that are at most at risk. And I'm going to talk now about how we can help the most kittens. I'm going to talk about a program that the Operation Catnip team developed to really upscale how we help more kittens. Are you feeling out of control? Are you dreading kitten season? Like I am a little bit. Part of it, I think, is helpful to look at the total number of kittens that are out there, the number of cats, and this is an estimate of the total outdoor cat population. You see that the blue section, which is the biggest one, is an estimate of 55 million unowned free-roaming community cats out there. And look at the tiny proportion of cats that are coming into our shelters and rescues, the yellow bar, and then the red one is the ones that are euthanized or don't survive being in the shelter. And so sometimes when we're talking about how do we upscale our programs, how can we let go of barriers to saving more cats so that we can bring more in, we get really focused on this tiny little sliver that is in our care and really out of sight, out of mind for all of those other ones that are out there just living. And if they make it to adulthood, probably doing well, but most of them don't make it to adulthood. So there's a lot of suffering there. So keep in mind that most of the cats are not in our rescue systems. So how many kittens need help? I think during kitten season, this is not an uncommon scene where you've got pop-up cages, extra cats all crammed in, stacked up in a shelter. And this is just a recipe for catastrophe as far as kittens because of the risk of panleukopenia and other infectious diseases, or just growing up in the shelter and becoming less adoptable or less socialized over time. We do know that community cats are the main source of new kittens. Most pet cats are spayed and neutered, thank goodness. Not always early enough. We need to back that down to getting pet cats neutered before 5 months. But community cats are really out there in these millions of numbers, and very few of them are neutered. So that's where most of the kittens are coming from. So really think about how can you also help your community upscale your TNR programs. We also know that 50 to 75% of kittens born outdoors don't survive to adulthood. This is really common with litter-bearing animals in nature, so we shouldn't be surprised by that, but it's also an intense amount of suffering that we could prevent by neutering. Also, it creates this urgency about helping kittens when we find them. So shelters are high risk for vulnerable kittens due to the disease, stress, and overcrowding they have. And if you want to get a ballpark idea of how much kitten size there is in your community, here's a really rough estimate. Take your human population, divide it by 6, and you'll get about 16,000 cats that we estimate for 100,000 people. And over half of those are going to be female. So in that population, out of every 100,000 people, we're going to have about 8,000 female cats out there breeding, community cats. So that can kind of like let you understand that we need to scale up programs that assist thousands of kittens, not hundreds of kittens across a community. So collaborating with all of the organizations to upscale our life-saving and to really communicate how urgent this is. We just cannot afford to hang on to kittens or to create barriers to improving the number of kittens that we can help because they're waiting. So the main source of kittens from survey from the audience at this webinar are found by the public, and that's certainly what we experience as well. People are out there encountering all these kittens that are being born, and they generally want to help. So they want to bring them in or they want to have another solution for them. A smaller number are transferred in between organizations or surrendered by owners or actually found by the organizations themselves. So we are called upon to address the need for people who are finding kittens and want to help. But as Monica said, in our superhighway system, we want to bypass the shelter. The shelter is not the right place to serve kittens the best. So this will help decrease crowding and disease and increase staff satisfaction. We know how burned out staff can be. It also increases the community involvement, and we will get new stakeholders, new volunteers, donors, and sponsors. If you think about it, the people who are finding kittens aren't usually part of our shelter system. And so they're coming in as unfamiliar with our systems, and we can be very supportive and add to our ranks by giving them a really good experience. And this also increases access to care for underserved cats. In our program, which I'll explain is called Kitten Shelter Diversion, about 20% at least seen are sick or injured. So we need to account for that when we're planning for these large-scale kitten rescue systems. So we have a Kitten Shelter Diversion Partnership. The provider is the veterinary care provider. In our town, as you heard Melissa talk about, it's Operation Catnip, which is primarily a TNR clinic. And we spay and neuter about between 8,000 and 9,000 community cats in our town. And it's been very successful in reducing the number of cats that are entering our animal control shelter. But we also are not that comfortable doing TNR on little kittens because we know the high mortality rate is there. And so we developed this kitten shelter diversion program, which utilizes the medical team at the TNR clinic, but doesn't become a foster program or a shelter itself. So this is truly a partnership with the people who find the kittens, and they're contacting the shelter or others wanting to turn them over to someone that will save them. And that really isn't available at the scale that we need. So we say we can't do that, but here is what we can do. If you will agree to take this kitten home, we will provide you with everything you need. We'll give you the medical care, whether it's the preventive health care, treating illnesses or injuries, and finally spay neuter before they adopt the cats out to their friends and neighbors. We'll provide the supplies that they need, the food, bottle feeding supplies, help them appeal to the public for donations. We'll also provide adoption support. They may be uncomfortable trying to adopt cats out if they've never done it before. So we have a special Facebook page in our community for community cats and kitten adoptions, in-person events that they can come to, and partnership with other organizations. Sometimes there's a situation where they really have tried to adopt out the kittens and it's just not happening. So in those situations, we might transfer the kittens over to our local humane society, all ready for adoption. This is not an inexpensive endeavor altogether with all of the support, the supplies, and the medical care that goes into this. It costs our organization about $150 per kitten. And they do over 1,000 kittens a year through the kitten shelter diversion program to keep those kittens out of our shelters, but it is free to the caregivers. So we do a lot of fundraising around this program. And again, we're trying to remove any barrier that someone might encounter to participating in this. Okay, the kitten finder, the community member who comes to us for help, also makes an agreement as part of the partnership. They house and care for the kittens until they are ready for surgery and homes have been found. They don't place the kittens until they've been spayed and neutered. Our kittens actually get a graduation certificate from the program when they have had their spay and neuter and they're ready to move on. They agree to find indoor homes if possible for the kittens, and definitely not to surrender the kittens to one of the local shelters or rescue groups. The whole point of this program is that it's a diversion program to keep cats out of shelters. And then they'll make all reasonable efforts to bring the mother cat and any other unaltered cats from the area. As Melissa said, kittens don't come from a stork. There's adult cats there that are breeding, and we don't want to just continue to take kittens off someone's hands. We want to stop the problem where it occurs. So in many ways, this is like a foster program, but there are some unique differences. They're similar in the sense that they serve underage animals. They keep kittens safe in homes and out of the shelter. It helps to mitigate the overcrowding in the shelter and prevents disease transmission. And it allows us to give pediatric medical care to get them healthy. And we also can have streamlined surgery days for them. But what is different, and this really is what makes it work, is there's no ownership change. These kittens are really unowned. They're not transferred into the care and responsibility of another organization. There is no shelter intake. The finder raises and places the kittens. So the whole burden on the outcomes of the kittens is really on them, but we give them lots of support and they feel very successful at it. And it does alleviate the shelter staff and volunteer workload compared to having kittens that are coming back for care through a foster program. And it can add some difficulty, though, for tracking cases because they're not in our system or owned by us. We really rely more on the caregiver for complying with the appointments and letting us know how it all turns out. And remember, of course, we're going to pair this with a TNR program because we don't want to leave the adults behind who are there. The kittens often are kind of sentinels for a community cat colony or at least a few adults. So we're going to track those down and support the caregiver in trapping those cats as well. We did a study that showed that a high volume intensive TNR program is the most effective way to reduce preventable mortality, and that is purely because it prevents the birth of kittens that are destined to be euthanized. And in this graph from this paper, you see that even low intensity TNR is going to result in fewer kitten deaths than low intensity removal, or it's going to, yes, it prevents more kitten deaths than low intensity removal. So we have to replace the traditional animal control model of continuously removing cats as a solution and instead do more TNR. So this is the impact of this program combined with the TNR program in our community. Operation Catnip was founded in 1998, and it started small and then has grown over time to perform about 8,500 spays and neuters a year. And last year, the number of those that were kittens were about 1,200. And so what we see in this graph here, the green bars are the number of cats entering our county animal control system. So back in 2001, when this chart starts, there were over 5,000 cats that came into the shelter. And the orange bars are the euthanasias. 4,000 of those, or 80%, were euthanized. That was the system that was in place when our community came together to make a change. And you'll see that over time with all of the programs, we've got rescue groups, the Humane Society, lots of spay neuter programs, TNR, is that both the intake of cats and the euthanasia plummeted. And then they implemented the kitten shelter diversion program to take it one step farther. And you see there's another decrease there in that box that shows as the kittens diverted increases, we have even fewer intakes and euthanasias at the shelter. This is a small group. It started very grassroots. It's something that you can do too, but it's only successful because all of the groups put aside their differences and collaborated on this project and shared their data. So what you also said in our survey for this webinar was, what was the biggest barrier to saving more kittens? And what we saw far and away, almost half said there were not enough foster homes. They didn't feel there was as much problems with money and staffing, but it was really all about the foster homes. So many comments on that. And you're going to hear from Marnie with Kitten College later today, and that is the answer to your foster home problem. You can scale up your neonatal foster capacity with the Kitten College method. It makes fostering much less scary and much more scalable than the traditional ways that we've often done kitten fostering. Can take the fear out of bottle feeding for those caregivers that are willing to volunteer to do that, or you can give them the easy kittens that are already eating. You can apply to become a Kitten College satellite campus, and they will come to your facility and train your team. And ultimately, this also keeps more kittens out of shelters and in foster homes where they're going to be safer. All right, let's talk now about some medical protocols. We're going to start with the preventive care protocols that apply to all of the cats. So this is a guideline from the Association of Shelter Veterinarians. They've come out with their second edition of Guidelines for Standards of Care in Animal Shelters. And you're going to find all of the protocols that you need here, including veterinary care protocols, how to work with veterinarians, protocols for vaccination and housing. It's all there, but it's intense there. So I'm going to give you the highlights here. The very greatest risk of shelter kittens is exceeding capacity for care when your foster homes are overloaded, or they're mixing litters, or when your shelters have more cats than they can provide adequate care, is when we see crowding, prolonged length of stay, stress, and that all adds up to disease. And with our most vulnerable kittens, this can add up to increased mortality and all of those deaths in the shelter that have been reported. I think what we haven't emphasized enough is the need for speed. The unserved kittens in our community that never even get a chance to come into our life-saving programs, or the ones that are already overloading our life-saving programs, are really at risk for bad outcomes if we can't move them through the system faster, remove the bottlenecks so more kittens can flow through and we can save more kittens. So we need to look at our programs and look at where every extra unnecessary day is being spent. Is it waiting for something that doesn't need to be waited for? It might be that they're bottle babies and they need to stay in our system for a while to grow up. But if they're just waiting for a vet appointment or for a spay or for the perfect adopter to come along or the next public event, that is unnecessary waiting. It's creating a bottleneck and it's reducing the life saving that your program can have. So we want to eliminate all those delays and barriers to positive outcomes. And I'm going to say something controversial here. Don't hate me, but if you have to wait a long time for a spay or neuter because of the veterinary shortage, I'm suggesting that you adopt those cats out with a contract, and it can be a foster to adopt or another prepay spay or whatever it takes to open up that life-saving space that you have, that kitten is occupying and just using up time for the next kitten that needs to come in for your organization to save. We know this is imperfect. We know some of those cats will not get spayed or neutered and might even reproduce. But the ones that are out there that we can't get into our systems because our systems are full, they're all reproducing. Or the cats that are being given away on Craigslist that are not spayed and neutered. Those are at much higher risk for reproducing than the ones that we adopt out with a contract and education. So it's not risk-free, but clogging up our system is much higher risk for bad outcomes for kittens we might not even see. Okay, the vaccines and parasite treatment, this is a lot, but it really should be considered kind of a cookbook or cookie cutter. We should not be improvising with vaccination. Just put it into your head that we should vaccinate all cats, even the sick ones, the pregnant ones, everybody at 4 weeks, and then every 2 weeks until they're 20 weeks of age, as long as they are in that high risk situation. Now, high risk is pretty much any shelter. It's any foster home that has more than 1 litter at a time, or any other situation where there's at risk for being exposed to infectious disease. This is very different than the kitten that's adopted, and it is a home with other vaccinated cats, and it's not encountering all of these other strange cats from different populations. And so a lot of veterinarians will not be familiar with this vaccination protocol, and it seems extreme. And in some ways it is extreme, but it's because the risk is extreme as well. So nobody should be exempted from getting vaccinated. Hopefully we will not have them in our system so long that they need so many massive number of vaccines. But for instance, if they come in at 12 weeks, they might just need a couple vaccines. If they come in at 4 weeks, they will need many more vaccines unless we can get them out into a home faster. We want to use the regular FVRCP. You really only need the panleuk, herpes, and calesi. You don't need the chlamydia. But make sure it's a modified live vaccine and not an inactivated one, because they both work, but the modified live works faster. And so we really are fighting the race against disease in a lot of these situations. Also make sure it's being handled properly. It should be mixed fresh, stored properly in a refrigerator, and given subcutaneously low on the right forelimb. If you can move the kittens into a low-risk foster home, you can reduce this tempo to every 3 weeks. And then rabies will be given at 12 weeks in the right hind leg. That usually requires a veterinarian to administer it. Although in Florida, they just passed a law that staff that are trained in municipal shelters can now give rabies vaccines. And that should help with shelters that don't have a veterinarian full-time. But keep your ears open. You might be hearing soon that a recommendation from shelter medicine programs to vaccinate even earlier. Some shelters are already vaccinating at day 1 if they're keeping their cats or puppies in high-risk shelters, and they're finding that it may be helpful and also that it doesn't seem to carry any risk. So that is a pretty simple but often neglected vaccination protocol. When we are called to consult on shelter outbreak situations, very often we can identify that they have this perfect protocol on a piece of paper, but it is not what they are doing. Too many people aren't aware of it or making their exceptions, or for some reason it's slipping through the cracks and they're not getting vaccinated on that very first day. And then we have parasite treatment, and this is another place you can be really efficient. There is really no need to run fecals on cats unless they're very sick or they have diarrhea that's not clearing up. It's so much better and more efficient and cost effective to just treat everybody for the common parasites. So again, we're going to begin treating at or before intake, but this, I can't give you a cookie cutter protocol for this because the parasites differ regionally and also just based on what you are experiencing in your shelter. But for all kittens should be treated with parental panleukopenia or something similar for roundworms, and that can start as early as 2 weeks of age, repeated every 2 weeks. That will get rounds and hooks. Then a lot of us will use Panazaril or another anti-coccidia medication just because coccidia seems to be so common in kittens and puppies as well. And it can debilitate them when they're under stress, which they often are in shelters, and they get diarrhea or they spread it to other animals. So we can start that at a little bit older age. And then selamectin or similar product for fleas and heartworm, that should say. And also it helps control intestinal parasites, but not quite as well as some of those other products. I put the link here to ASPCA Pro. The ASPCA has a whole shelter medicine section that's really outstanding. It's got lots of videos, lots of protocols. You don't have to start from scratch. It's got training modules for staff. And so I encourage you to go investigate everything that is on the ASPCA Pro website and explore there because there's protocols for everything you might need for kitten rescue and sheltering. Another reference from the ASPCA is their disinfectant quick reference. So it talks about all of the commonly used disinfectants in shelters, but I would want to emphasize that there's 2 steps to cleaning. One is to clean. That means you wipe it down with some kind of soap, get all the organic material, whether that's feces, urine, slime that builds up, saliva, mucus, etc. It's all going to be removed first, and then you apply your disinfectant. If you just spray down disinfectant on top of a dirty cage, it cannot work effectively. It also requires proper dilution of the disinfectant and proper contact time. And that contact time will vary in the temperature as well. So if you're in the cold part of the country and it's icy outside, that contact time needs to be a lot longer. For cats, it's really pretty simple. We should be trying to use accelerated hydrogen peroxide. For cats, it's very safe and it works reliably against panleukopenia and calicivirus, which are resistant to most of the other disinfectants. You can use bleach, but it's really harsh on, especially in the home environment. It's often not used appropriately. It can stain your clothes, it can corrode metal. And so even though accelerated hydrogen peroxide is more expensive, it's really something worth fundraising for. And this would be like Rescue or other products, Axel, that you might hear about. All right, that's the routine. Healthcare, I'm going to talk about pediatric neutering now, and we definitely want to aim for neutering all of our cats before they're adopted, if we can, if it doesn't slow us down. And then, of course, we have lots of TNR to do as well. Now, people are becoming confused because there's a lot of controversy right now about the health impacts of spaying and neutering dogs, especially large dogs. And there's a lot of science that's not very good in that realm, but there's some enough good science in there that there probably are some health concerns for dogs, especially larger dogs, with neutering, either the age of neutering or the whether you to neuter at all. But none of those concerns apply to cats. So if you've been hearing people that kind of let this halo effect of negativity about dog neutering flow over onto cats, you can be very comfortable that science supports early neutering of cats. So we have some bad news. I'm sure you've been feeling this, is there is a veterinary workforce shortage. And that has trickled down to create a deficit in access to spay neuter, and especially affordable spay neuter. So this is a study that is in press right now, about to be published. We've been tracking the number of spays and neuters that are performed across the country in nonprofit clinics that use Clinic HQ software. And we've been comparing it to the number of spays and neuters these clinics did in 2019 before the pandemic. So you can see that it was, between 300,000 and 325,000. And then we had the pandemic shutdown, so spays and neuters plummeted during that time for a few months, and then it kind of bounced back up, but it did not bounce all the way back up. We have been below 2019 levels in spay and neuter since then, and in fact, it's getting worse. So we are very nervous about the inability of the spay neuter system to return to its former level. And what you're seeing here is we've estimated that there are now is a gap of 4 million surgeries that have built up that have not been performed that would have been done if there hadn't been this dip. And of course, now, all these years later, a lot of those litters are having litters of their own. So it's a compounding problem. We also see is in the private sector, we've been pushing for a long time for the private sector veterinarians to spay and neuter kittens before they can come into heat. We're seeing kittens now that are coming into heat at 4 months. They're even becoming pregnant at 5 months or developing pyometras at 5 months. So we really need to back down and try to get all of the kittens spayed and neutered before 5 months. This is a chart of 4,000 private practices, and the ages of cats that they've spay neutered for the past 5 years, it adds up to 5 million cats. And you can see I've put a little line around the age we would like them to be neutered, generally between 8 and 20 weeks. And then look, the vast majority of cats are neutered later, well after they're old enough to become pregnant and have a litter. And so this data is from VetSource, which collects data from private practices, and it's very helpful to see what the trends are there to balance against the nonprofit sector that we're seeing. And the study was funded generously by PetSmart charities. So there's a Feline Fix by 5 initiative in which experts came together and looked at all the data around the safety of spaying and neutering in cats. And they concluded that it was safe and efficacious and desirable to spay and neuter all cats before 5 months of age, prior to puberty. And these are all the veterinary associations that have endorsed this plan. Again, to reiterate, there are no negative health effects in contrast to dogs. So just remind people of that if you think that there's a reason they're holding off. And remember that most litters in owned cats are unplanned. The owners are not aware that cats could reproduce so young. So we need to keep working on helping change that education. But we also know that most kittens are born to community cats. So that's where our TNR program comes in. We have a little less control over scaling those up. And for shelters and rescues, the ideal age is about 8 weeks prior to adoption. And so they can be safely neutered. That's the age that many states allow adoptions to happen. It's very convenient. Most kittens are well weaned by that time and are healthy. But when there's a situation where the shelters are too crowded and they've got 6-week-old kittens, that should get out of the shelters. It's fine to spay and neuter them too if they're fat and fluffy. Technically, as a veterinarian or as a veterinary technician doing anesthesia, these are very easy surgeries to perform. They're very safe. They're faster. They're less painful than an adult cat, certainly less so than a cat with pyometra or pregnancy. And so as long as the cats are healthy, there's absolutely no reason not to neuter them earlier if that is going to move kittens through your pipeline. And as I also mentioned, that if you have to wait because of this veterinary shortage and you've got cats taking up your capacity for care that are not moving along, that means other cats are dying. And it really is that simple. So sometimes we have to take the bitter pill and adopt these cats out with the contracts or foster to adopts. And we know we'll not be perfect, but we know we're going to save more cats that way. All right. Well, we also asked you who's doing your veterinary care, and most of it was shelters. And so they had their own in-house vets, or they were using a private veterinary clinic, which can be good if you don't have your own veterinarian, but can be pricier and harder to get access to that care. Some shelters or participants here are using a vet of record, and I'm going to talk about that if you don't have your veterinarian. And then a small number of organizations actually does contract out their veterinary care to another organization in their town in a collaboration. So you've all heard about this, the veterinary workforce shortage. So it's great to say we're going to provide all this veterinary care for animals in our care, and then we're going to do kitten shelter diversion, provide free care for the community, and then we're going to get everybody spayed and neutered. But we know that there's often just not enough professionals, veterinarians and technicians that are available to do that work. And this is a crisis, and we need to look at how can we recruit and retain more workforce. And that's a whole nother topic, but understand that right now we need to be very nice to our veterinary care teams and also to be selective about how we're using those spay neuter slots. So this was a study we did with Petco, Love, and they surveyed their grant recipients, and nearly 3/4 of all of the shelters and the low-cost clinics had open positions for veterinarians and veterinary support staff that they were unable to fill. And so this meant that some had stopped doing surgery altogether, some even closed their clinic operations. We also asked how many spays and neuters were backed up in shelters, and it was over 20,000 cats and dogs were waiting for surgery in shelters because they couldn't keep up with the demand. So this is a paper that you can read in the Shelter Medicine Journal to look at more details about the impact of this nonprofit veterinarian shortage. So this brings up an alternative for how you can get access to some needed veterinary care and veterinary supplies if you don't have your own veterinarian. If you haven't heard about Shelters United yet, you definitely should look them up. It's a group purchasing program. So lots of shelters and rescues can join. And when you purchase as a group, you get better deals from the vendors. And they have medications, including prescription medications and controlled drugs, vaccines, food, and supplies. Now, many of these vendors are going to require a veterinary license to make these purchases. And so what do you do if you don't actually have one on staff? You can develop a relationship. It's called a veterinarian of record. And this is a formal relationship, and it's built on trust, where the veterinarian that works with you, but is not at your facility all of the time, provides their license and even might provide their DEA number so that you can order drugs and medical supplies. And when this works well, it's a very, very successful way to get access to the supplies that you need to keep your animals healthy, especially if you're a smaller group or you've had an open veterinary position for a long time. So the veterinarian of record will develop the policies and protocols for the shelter to follow under their indirect supervision. So they might be, they're often work at another shelter, or they might be a private practice veterinarian. So they're going to say, these are the guardrails. This is the protocols I want you to implement. And then they will do check-ins once a week or once a month, or even less frequently if it's going really well. The animal welfare organization agrees to follow the protocols and pays generally the veterinarian of record for their services. This is a professional service that they need to be reimbursed for. And there is this amazing new toolkit on the Shelters United website that goes into great detail about how to make this a successful relationship. There was a paper that was published that surveyed animal welfare organizations and their veterinarian of record about how it was going. And it might not be a surprise to know that the shelters and clinics thought it was going great. And the veterinarian of record was very frustrated because they felt like they were being taken advantage of, or the staff was not operating within the guardrails that they had set up. So that was the purpose behind this toolkit, was to come up with some templates for written agreements and better understanding about what everybody's responsibilities are. So please do take an opportunity to go explore that website at Shelters United. And they just launched a course. It's just a 1-hour course that you can go and take online. You can get race credit for it, so that's good. And it's an introduction to the veterinary of record and how it works and what everybody's responsibilities are. The website goes into much greater detail, even with documents that you can modify for your own use and case reports of ones that have gone well or not gone well. All right, this last section is responding to disease threats. This is medical responses to either prevent disease or to treat them once they came. And this is a quick romp through some common ones that on your surveys you asked for information about, but it's certainly not detailed. You can go to Maddie's University and find much more extensive detail on each of these diseases. And there's just a wealth of information there. So this is one of our regional shelters. They've got this cat housing. You can see it's stacked 3 high. It's wire. There's really no biosecurity. It's a rural shelter. They're doing the best they can, but this is a really high risk environment. And I put a little inset there of a mama cat and her babies, and they're just kind of sitting ducks in this kind of environment, especially in kitten season when it's very crowded. It's just impossible to have any kind of sanitation in this kind of housing. So briefly, upper respiratory infection, if you're seeing a lot of it, it's generally because of overcrowding and stress in cats. So the risk is most severe in neonates and crowded populations that are stressed, and when you are exceeding capacity for care. And there's whole webinars also on Maddie's University about what is capacity for care. And it's not just the number of cases that you have, it's the personnel, it's the sanitation, it's how quickly they can get through the system, how many adopters you have. All of that goes into capacity for care. And cats are so uniquely susceptible to becoming diseased, especially with upper respiratory infection, purely from stress alone. So the signs are what you've all seen: oculonasal inflammation. They can even have ruptured eyes. It's a common injury we see in kittens, where they often come in from the field that way. Sneezing, coughing. Cats don't cough a lot, so if you have kittens that are coughing, you might think about Bordetella in those situations, or just fading kittens. Diagnosis, generally, we're not going to try to diagnose the exact cause most of the time unless we're having higher numbers or more severity than usual. But usually we're going to guess based on clinical signs and treat them all the same, remembering that these are viruses and we don't have antiviral medications. So when we use antibiotics, we're just trying to treat the secondary causes most of the time. And then the PCR panels are great for when we want to dig in more because something unusual is happening, but we know that they're pretty spendy. Treatment is going to be symptomatic support. We want pain relief. We want nutritional support, keeping their little faces clean. And then doxycycline is usually the drug we start with. And you can use that on tiny kittens as well. Historically, there's been concern about their teeth development, but we really don't see that in cats. So go ahead and use doxycycline on everybody. Know that a lot of these pathogens that go into upper respiratory disease complex are highly infectious, but not as much from cats like coughing and sneezing on each other across the aisle, but more because we handle them and we become contaminated and then we handle the next cat. It's pretty hard actually to avoid doing that. Think of it like ringworm, how carefully you would treat ringworm and approach your URI in the same way. Many of these pathogens look exactly the same clinically. So you might have Bordetella in cats, which would be more severe and has a higher mortality rate, but you wouldn't know because it just starts out like an upper respiratory infection. And they can get that from dogs. You definitely want to do some PCRs and look at protocols and compliance with protocols and how they're using the disinfectants. Are you using the right disinfectant, which would be that accelerated peroxide again? And so if you're having increased incidence, don't count on just having a good protocol. You really need to go watch it, just hang out with the staff and watch them work. People take shortcuts. They aren't trained often, and they hand down information, or they're just too busy to do it right. So just hanging out and watching stuff get done is very, very helpful. The mild signs, you might not have heard this before. If they have really mild URI signs, sometimes we don't move them out of the adoption ward. We just want to care for them last. But sometimes the move is more traumatic and stressful than keeping them there. And because they don't really sneeze or cough their droplets very far, just a few feet, unlike dogs. Dogs can sneeze or cough 20 feet away. Cats really are bad at that. And so their droplets don't go very far. But we do. So if we handle that cat, we can definitely contaminate the other cats. Again, I'm going to keep saying this, is the very best action you can take is decrease that length of stay. And if you're decreasing the length of stay for everybody, then you will not run into capacity for care issues. All right, FeLV and FIV, our group does a lot of research on this, and we have this very extensive 25-page report from the American Association of Feline Practitioners. with much minutia about these retroviruses, including a whole section for shelters on diagnosis and management. So all of the details that you would need are available for free in this document. So I definitely think if you're caring for cats that you should get a glass of wine and read the whole thing. But here's the short story of it. The risk is primarily FeLV is transmitted mostly from infected queens to their kittens. And so when you do TNR or any other spay on those cats, you are interrupting the infection of new kittens. Now, it can spread within a household, and it can spread among your group house cats or in a sanctuary if they're not segregated, but it's not highly infectious like panleukopenia or URI. FIV is even less infectious, so it's spread primarily by bite wounds among intact male cats that are outside fighting. And so those cats, once we neuter them in our TNR programs, then they become very docile and they kind of hang around the food bowl. And so we stop the spread of FIV by neutering males in TNR programs. You in a shelter, it turns out to be quite safe if the cats are not aggressive to group house FIV positive and negatives together, or even to adopt positives into households that have negative cats. We just don't see that kind of transmission as long as they don't fight. But remember, both of these are transmitted well by blood and saliva contamination. So we need to be careful that, when we're doing surgery or cleaning our endotracheal tubes and everything, that we're really being quite good at sanitation and sterilization between cats, because we can easily spread it by using like one pack to spay a few cats or not cleaning our dental instruments or endotracheal tubes perfectly. The signs for both of them are generally asymptomatic. We can see fading. In kittens, as they get older, the FIV cats might get stomatitis or other problems, and the FeLV positive cats might get anemia. But for the kittens, we're generally going to see they're either going to be healthy or fading. There's nothing really specific about these viruses. I'm generally going to just use a point of care SNAP test, and you should use whole blood for that. This is a new finding that is a better sample than serum or plasma. You might find veterinarians who haven't heard that yet, so use whole blood. And then I'll talk about when we might want to use PCR as well as a secondary test. Treatment is all symptomatic support. There's a ton of supplements that claim to improve immune systems, but none of them have proven to work, and there really aren't any antivirals that are practical either. So we just treat what we can treat, all the secondary problems that they have, and many of them, the FIV cats might live a normal lifespan, never get sick, and even a lot of the FeLV cats will live for years. The precautions, we do want to segregate FeLV. So if you have a shelter that has single cat housing, you actually can, you don't need to put them in another room. You just keep them in a separate cage. You don't even have to test them in the shelter if you're trying to prioritize the use of your resources. But if you're group housing, I would test for FeLV. But it's not necessary to segregate or even test for FIV in the shelter. This is something we don't have good data on yet, but I hear a lot of questions about. We have a litter of kittens. Some are testing positive and some are negative. What should we do? And at this time, my recommendation is to separate them based on their status and get the negatives away from mom as well, because she likely is the source of it, and then raise them up and hope that the ones that are negative, they definitely had exposure, but they might not have got enough virus to get infected. We've done this kind of anecdotally, but we have not looked back in a rigorous scientific way to see if this is helpful. The outcomes are better if cats are in homes with 0 to 2 other cats than if they're kept in shelters or sanctuaries. And this shouldn't surprise us, because we know that the thing that stresses cats the most is other cats. And so they like to be in homes, low stress, low activity, and low cat density, and they will live longer and have less disease. If you are not doing testing in the shelter, it's very important that your local veterinary community be on board with that and know. So make sure you educate them about why you're choosing to use your resources in a different way in the shelter, because in the past, we used to just test all of the cats, and that's kind of what veterinarians got used to. And now sometimes we're suggesting that we need to use that money in a different way, and we advise them to get tested at their local veterinarian. That also is not without risk. We always tell people to segregate their new cat until it's tested. They never do. And then if they go to a veterinarian that's not familiar with this, we have had people feel very betrayed and not supported if their new cat, their kitten has FeLV especially, or even be like bullied into euthanizing it. So good communication in that handoff process is so important. And then just make sure that we're not wasting resources on routine testing in TNR programs. That is not how we should be using our scant resources. We need to TNR as many cats as we can if we're going to make a dent in that huge population you saw earlier. And so every penny should be going to neutering more cats. And as you see, if we neuter the females with FeLV, they don't have infected kittens, and then the males stop fighting, so they're not spreading FIV. If you know a cat is positive and it's healthy, in your TNR program, go ahead and release it back. It's not changing the dynamics in the neighborhood at all. Those viruses are already there. So this is what we currently recommend here in our shelter medicine program at the University of Florida. So you have your point of care test. The SNAP test is the best. The second best is the witness test. I would not use other tests at this point because we haven't compared them, or like the vet scan we have, and it performs very poorly. And so Zoetis owns both the witness and the vet scan, and they like to sell the vet scan more. But if you're buying from them because it is cheaper, it takes up less space, get the witness. It's nearly as good as the SNAP test, which is usually more expensive. Use whole blood. That is new, and that's nice because that's actually more convenient than spitting down a sample. And really, I think for most cats, Monica and I have a webinar on this at Maddie's University. One and done is fine for most cats. You're going to be accurate the vast majority of the time. And so you can stop there unless the cat is high risk, like it came from a hoarding case with other positive cats, or it's got a disease that really looks like it, or the mother was infected or something. You might go do more testing in there. But if you want to stop with your point of care tests, one and done, and move on with that, that is very appropriate. If you want to continue, that's where we do the quantitative PCR. The quantitative PCR is for FeLV, but you can also do the same kind of testing for FIV. One and done is fine, and then you can do a non-quantitative PCR if you really want to know. So if the point of care test and the PCR agree, that's called confirmation. And that is, you can be confident the result is. If they disagree, you don't know which one is correct. That's the problem. You can have either one be positive or negative, and it still occurs. Why does it matter? This is survival. So some people want to know what the prognosis is for a cat. If with the quantitative test, if they have a low amount of virus, they survive really as long as a cat that's uninfected. If they have a high level of virus, this is a group of 130 cats at Austin Pets Alive that we're following, past 7 years already. Their median survival, their average survival after being diagnosed was about 1.5 years. But if they had a low level of virus at that first test, they really survived quite well. So panleukopenia, it's the bane of kitten season for all of us. This is just a collection of news reports of many shelters that are closed down because they've got panleukopenia. The risk is in young cats in dense populations with a poor vaccination history. So, i.e. most shelters. Also occurs in the field. You know, the signs are like parvo in puppies, except we don't see the bloody feces. It's just lots of fading and vomiting with some diarrhea. Very high mortality untreated. We diagnose it with the fecal parvo test, so your dog test is good for this. Again, get a good brand, but it's only sensitive, going to detect 7 out of 10 cats. So if it looks like a parvo kitten, a panleuk kitten, treat it as if it is. We treat these with fluids, antibiotics, nausea and pain medication, good supportive care. If they can get ICU level care, 90% survival is possible. A lot of times they cannot get that level of care, and those might be some that are found dead in cage. For this precaution, it's highly infectious. There's incredible environmental persistence. It can be there for a year. We can have crowding, stress, litters that are affected. We do need to, if we're going to keep these cats in the shelter, have strict isolation and PPE and follow vaccination protocols. Stay tuned. There may be information coming forth of using the canine monoclonal antibody in cats, sub-Q, and that might really help with panleuk. FIP, I think most people are familiar with this. There's now a treatment to this formerly fatal disease. Young cats are at risk in dense populations. Shelter conditions do increase the risk of FIP because coronavirus spreads more quickly in that situation. And so the diagnosis is there's no great test for it. It's really a clinical assessment of the veterinarian. We used to have to get GS medication, antiviral medication from overseas, and now you can get it at your compounding pharmacy. Cheaper and better in these little pills or liquid. Very, very effective. And so you can work with your veterinarian kind of out in the open now to get these drugs. I showed the Stokes was the first one to bring it to the US, and they've got all of this great CE that you can send your veterinarian to, and really helpful documents. They're a little more expensive than some of the other compounding pharmacies now that kind of rode on their coattails, but I'm still using their product because I know it's going to be good. And then finally, bird flu. This is just something I put in at the end because we're hearing a lot about it and it's spreading. We're seeing more cats that died. There's been over 200 cats in the last 2 years, and most of those have died. There probably are cats that are not as sick, and so they're not being recognized and recovering. So the risks are cats that are outside that are around sick birds, especially waterfowl, wild birds that are migrating, or that have access to raw dairy and raw meat, especially raw poultry at this time. So the signs are very unique. They have respiratory signs, but they also have neurologic signs often. And we don't see this very often in cats except for rabies. And there's very high mortality within days of getting infected. We diagnose this with pharyngeal swabs or at necropsy, and you may be able to get your state or the regular commercial labs to help you. Some of the state labs are so busy with poultry and cows that they're not even accepting companion animal samples at this time. There is no treatment that's been tested on these cats, but possibly antivirals might work. The influenza antivirals like Tamiflu. One cat whose 2 friends died was treated with an antiviral and did survive. So precautions that I hear a lot about is, what about you're doing TNR? What do you need to do differently? One is feed them in a way that does not attract the cats to water. So if their feeding stations are down by the pond, move those up away from water where the wild birds are going to be, and also feed in a way that doesn't attract other species to come. So don't overfeed on the ground and have the possums and the raccoons and the birds come. That's really risky to combine species like that. We added questions to our TNR intake form for, is this cat from a dairy or a farm? Have you seen illness in the other cats? Things like that. And if you have a cat that you think is exposed or is sick and your testing is put that cat in isolation and wear full PPE, because people can get this infection from their cats most likely. So that includes like eye protection, face protection, gloves, gown, the whole works. So this is something I want everyone to know about, which is post-adoption support with Petzl. You can sign up with this. It's free, and it will suck information from your computer system, from your shelter, and it will do post-adoption follow-up surveys and communications with your owners. And the shelters that have used this have seen a 20% decrease in adoption returns, so really reduces the risk of getting cats back. And then this is my final slide. It is all of the references that I recommend that you go to later when you have time, where you can get a lot of information in more detail.
Excellent. Thank you, Dr. Levy, and everyone for being here. We appreciate you.
Great being here.